EMS Rapid Response Team for COVID-19 Testing, Anterior Nares Nasal Swab Supplement. This presentation describes the procedure for anterior Nares nasal swab testing. Some individuals may not tolerate the long probe required for a nasal pharyngeal swab. Another option is to use the anterior Nares swab collection kit. This procedure is less invasive, better tolerated, and in certain circumstances, the patient can even collect their own sample under supervision. Prepare your equipment and the patient just as if you were going to obtain a nasopharyngeal swab, with proper attention to full PPE and safety precautions. We will now review the procedure for collecting an anterior Nares nasal swab. Position the patient so they are comfortable. Their mask should cover their mouth but not their nose. Remove the sterile swab from the packaging. Gently insert the swab into the nostril at least 1 centimeter or half an inch and firmly sample the nasal membrane by rotating the swab and leaving in place for 10 to 15 seconds. Gently remove the swab and sample the other nostril with the same swab. Swab the second nostril using the same technique. Finally, gently remove the swab from the second nostril. Be careful not to touch the tip of the swab. Insert swab into tube containing viral transport medium and break it at the score mark on the shaft so it does not protrude above the rim of the container. Make sure the liquid medium covers the swab tip. Ensure the cap of the viral transport media tube is securely tightened. Assure that the sample is labeled with client name, date of birth, and date time collected. Place specimen in transport container. Follow other standard collection procedures, donning and doffing, as previously reviewed. Coordinate storage and disposition of the test kit with the MedTech team leader. Specimen collection performed by patient under the supervision of healthcare personnel. Some patients, if given detailed instructions and under the supervision of healthcare personnel, will be able to collect the anterior Nares nasal swab themselves. This will allow for increased safety for healthcare personnel as they will not have to have close contact with the patient under investigation, but rather can use a window, door, or electronic method to watch the patient test themselves to assure proper technique. In this situation, the healthcare personnel will wear an N95 and gloves to review the procedure with the patient from a distance of 6 feet or more away. Have full PPE available in case the patient cannot perform the testing themselves and you have to do the test for them. Assure that your N95 mask is on and don clean gloves and review the procedure with the patient. This includes all steps of the procedure. Patient will first perform hand hygiene prior to specimen collection. The patient will open the swab package. The patient will gently insert the swab into their nostril using a gentle rotation. Patient will push the swab until they meet with slight resistance and they are about 1 centimeter into the nostril and against the nasal membrane. The patient will rotate the swab several times against the nasal wall for 10 to 15 seconds. Patient will repeat with the same swab in the second nostril. Patient will then gently remove the swab and insert the swab into the tube containing the viral transport medium located in the tube rack and either place the top on the tube or break the shaft in the indicated spot so that the swab does not protrude above the rim of the container. Explain how to label the specimen collection tube. Patient will wash hands or use hand sanitizer and then wipe down and/or clean the specimen collection tube. Verify that they understand the instructions to do the testing themselves and answer any questions they have. Verify the patient still wants to be tested. With clean gloves on, place the testing kit near the door or location where testing will occur. Whenever possible, use a window, door, or electronic method to watch the patient test themselves to assure proper technique. Ask the patient to go to the location where the sample will be collected and observed. The patient now tests themselves with the above procedure. Now ask the patient to place the specimen collection container outside their door. Healthcare personnel should maintain a distance of at least 6 feet when this is done, further if possible. Once the patient is back in the testing area, healthcare personnel who is wearing gloves will pick the specimen up and ensure it is properly labeled and place it in the appropriate packaging. Remove gloves and discard them appropriately in a trash receptacle. Healthcare personnel should wipe down the cell phone if used to communicate with patient and exterior of specimen packaging. Perform hand hygiene using hand sanitizer. Coordinate storage and disposition of test kits with the med tech team leader. Review. Be sure patient is okay prior to completion of testing. Review isolation guidelines. Complete all paperwork. Check in with the med tech team leader and debrief the incident. This concludes the supplemental training for collecting anterior Nares nasal swabs.